Our primary objective in organizing this symposium is to create a common platform for engagement and dialogue with our major stakeholders and the general public on the role of the COVID-19 National Trust Fund, and to also speak about our activities and our programs. We also wish to use this engagement to solicit your valuable inputs and contributions that will aid us in fashioning a way forward for a more effective discharge of our statutory mandate. And on this note, I'm very grateful to Nana Krobia Asante Sokorehene for informing us of the shortcomings, even in the methodology of our deliveries, because when you're giving, it is, well, the Bible says your left shouldn't know what your right is doing, but when you're working, also for, pardon me, when you're dealing in the world system, sometimes it's good for the left to know what the right is doing, so that as the left moves, the right also moves. So we will do better. Thank you very much, Nana. Now, the COVID-19 National Trust Fund was established by the novel Coronavirus COVID-19 National Trust Fund Act 2020, Act 1013, with the following stated objectives. A, to complement the efforts of government to combat the COVID-19 pandemic by providing an avenue for well-meaning individuals, groups, and corporate bodies to contribute or donate monies and resources that may be required to combat COVID-19. And B, receive any other monies or resources contributed or donated to combat COVID-19. Thus, all monies received by the fund are paid into bank accounts of the fund. Furthermore, such monies and any other resources are vested in the Board of Trustees, who are enjoined to apply such funds and resources to A, support persons engaged in the combat of the COVID-19 pandemic, and B, support needy and vulnerable persons infected with or affected by the pandemic. The governing body of the trust fund is a 7-member board of trustees who have been introduced. One member is absent, Mr. Kofi Bakman, Kofi Bakna, because he had a long-standing prior engagement. This board of trustees was sworn into office on 8th April this year by His Excellency, the President of the Republic of Ghana, Nana Akuffo. And we have been charged with the responsibility of managing the fund in accordance with the provisions of Act 1013. The fund has so far received contributions from over 600 donors, made up of individuals, both from the public and private sectors, social groups, religious bodies, NGOs, public and private associations, as well as public and private corporate bodies. We're extremely grateful to all these benefactors for their generosity, and we appreciate their various donations and contributions in cash and in kind. Cash donations received to date amount to 57,023,932 Ghana cedis, 95 pesos. In addition, we have received various material gifts in the form of services, food and non-food items valued at approximately another 8,228,000 plus some others Ghana cedis. It is these contributions that have made possible the variety of interventions the COVID-19 National Trust Fund has made so far and will continue to make. Since the establishment of the Trust Fund, we have undertaken numerous interventions, including the provision of material support to medical facilities such as testing centers, special COVID-19 care management centers, regional and district health centers, and CHIP compounds. We have supported the COVID-19 private sector fund in the construction and completion of the National Infectious Diseases Center. We have also given support to certain vulnerable groups in our communities, and I believe we have an ongoing building conversion project for the Pantang Psychiatric Hospital. Altogether, we have spent an amount of 41,738,987 Ghana cedis from the total amount received. Clearly, our financial resources will continue to dwindle as we continue to execute various projects, programs, and activities in line with our mandate. Coupled with this, we continue to receive requests for support from sections of our society to sponsor one project, initiative, program, or another, almost on a daily basis. Unfortunately, there seems to have developed over the past few months a rather misconceived belief within large sections of our society that the COVID-19 pandemic is going away or is even no more with us. Couldn't be anything further from the reality. This misapprehension has resulted in a drastic reduction in the frequency of donations and contributions to the fund. Thus, from the end of August this year to the middle of this month, we have received only one cash donation from one individual. No other donation at all has been received. Nana Chairman, distinguished ladies and gentlemen, this situation calls for a reawakening of the fighting spirit in all of us. The classic and renowned Ghanaian team and group spirit, because it is important for us not to relent in our efforts, but to rather confront the COVID-19 pandemic with more strength, attention, and seriousness that can be mastered. The fund needs to intensify public education and sensitization programs in the various communities across the country. We need to provide more PPEs and medical items to our frontline workers because most of these are disposables. We need to form stronger partnership with more public and private agencies and associations that will enable us embark on more behavioral and attitudinal change management through age-effective and aggressive communication programs to prevent the spread of the virus in all communities across the country. We can do all this only through your continuous support and contributions. This is one of the main objectives for organizing this symposium, for us to emphasize the need for a collaborative approach to the combat of this pandemic. So where are we going with all this? As a trust fund, distinguished ladies and gentlemen, although the collective efforts of the government of Ghana and all the supporting state agencies and institutions had yielded positive results in the combat of the coronavirus pandemic, to the point of reducing the number of infections to less than 500 cases until the end of October. There is now a startlingly steady rise in infections once again, with cases of infections standing at 1,019 as at yesterday, November 23rd, 2020. We had thought at the beginning of October that by this time, cases of infection would be negligible numbers, but it has not been so. It has rather risen very high. This situation is all the more disturbing when we take into account daily developments in Europe, America, and other parts of the world, and witness an even more virulent second wave of the coronavirus infection and the related deleterious effects of the pandemic on all citizens and economies of the world. We also have the elections coming on in a couple of weeks. People are going to push and shove and crowd together, all in disobedience of the protocols, but we can expect it, we can anticipate it. When people are anxious, people misbehave. And therefore, post-elections, what will happen in the level of infections? And then Christmas is coming. Our brothers and sisters and cousins and the tourists from outside where the pandemic is raging, some of them will be coming home for Christmas and for New Year and for all kinds of family events. So January, where will we be? That is the question we also need to begin to ask and to begin to prepare to stand against any hardships and crises that will be created by these events. This is a clear indication that we may have to deal with the pandemic for a longer period of time until the world scientific community comes out with a vaccine that will help contain the disease, especially as we look forward to a successful trial testing of the efficacy and safety of the vaccines that have been announced and which will hopefully enter into production for worldwide distribution in the first quarter of next year. All that is hopeful talk, because the medics, sometimes they don't speak with one voice. Some will say that by the time the efficacy and the safety of what has been discovered or what has been produced so far has been verified, we shouldn't be looking at any timeline less than between 6 to 8 months. So there's still a lot of uphill battle that we need to anticipate. The song that was sung over the video said, "Muma yenko sumfro yerifro," and I recall that there's a line in that song which says, "Kukuno etifi dasuwe chiri." Let us anticipate that and prepare for that. Now, since COVID-19 is completely a new virus and scientists are yet to determine everything there is to know about its behavior, preventive measures need to be the primary focus everywhere, especially in the more populous communities across our nation. Even when an efficacious and safe vaccination program becomes viable and available, those are also conditionalities, viable and available, prevention of infection will remain of paramount importance most likely for years to come. Nana Chairman, ladies and gentlemen, today speakers will address matters such as the overview and future challenges of the pandemic, challenges of caring for the sick, aspects of the socio-economic impact of the pandemic, the need for continuous support to the trust fund, and many more items and matters. These are but examples of why national as well as global cooperation, alignment, and stewardship is needed in the field of health, since what we are confronted with is a global health crisis. What we need is not just to conclude that this is important, but to identify and develop meaningful tools and to make things happen. In this room, we represent government, key health and educational institutions, non-governmental organizations, the private sector, CSOs, professional associations, etc. My hope is that this day gives us an opportunity to build stronger ties between academia, the private sector, the financial sector, the voluntary sector, the health sector, and all relevant sectors in Ghana. Then in the next years ahead, collectively combat the pandemic and even similar pandemics or epidemics. This symposium presents therefore an opportunity for all hands to be brought on deck and in an all-involving manner, so that when we achieve strides and successes in this fight, it will be a success story for all. Let it not be justifiably said that those who didn't take part in the combat behave as if there was no real fighting. Or similarly, those who are not part of the maritime expedition tend to feel that the sea is calm. The sea is not calm. And whether you are observing it or you're actively on an expedition, you need to participate. Our clear understanding and appreciation of the nature of this fight will urge us on and encourage us to continue to contribute our quota in every way, howsoever small, to support the COVID-19 National Trust Fund. I'm therefore using this opportunity to repeat our appeal to all of you, both present here and watching on the live streaming. Whether in your individual capacities or as groups, corporate bodies, public or private associations, etc., to contribute to the trust fund to enable us continue to discharge our mandate of complementing the government's effort in the combat against this pandemic. We need more funding and we need more material support of every kind to reach every medical facility in the country by providing more vehicles, medical items, PPEs, etc., etc., etc. And in other instances, even to support in the construction, rehabilitation, and equipping of CHIP compounds, health centers, more special isolation centers, care management centers, and many more. We have so many requests from the security services concerning quarantine facilities at borders and so on and so forth. And a lot of these we cannot even satisfy. We also need more financial support to enable us to intensify public education, information provision, and sensitization programs in every community and every corner of the country. The COVID-19 pandemic is still with us. We do not know when it will go away. Therefore, none of us should dare be complacent or approach the fight with a lackadaisical attitude. All efforts need to be made and all hands need to be brought on board to bring the pandemic under control. So in conclusion, Nana Chairman, we value the presence of everyone here today and the people who will be speaking at this event today to help us to determine the path of working together. I have no doubt at all that we are going to have fruitful deliberations, the outcomes of which will go a long way to strengthen and advance the operations of the COVID-19 National Trust Fund to effectively complement the government in the fight against the pandemic. So once again, it's my pleasure to welcome you to this program, and I look forward to a very fruitful a set of fruitful deliberations. And throughout, let's also remember to remain within the protocols at all times, and that's why the sanitizers are all over the place. One thing I've noticed is that whenever I attend meetings these days, whenever somebody finishes speaking, even if you didn't move, when you finish speaking, you sanitize. Somehow it's become a habit. It's good. Let's sanitize, and let us keep Mother Ghana healthy. Thank you all very much. Thank you.